You're listening to episode 6 of the Fed and Fearless podcast. Today, we're interviewing Cory Levin about how to optimize your fertility even when you've been diagnosed with PCOS. So stay tuned. Hi, I'm Laura Schoenfeld. I'm a registered dietitian and coach trained in functional medicine with a passion for helping women just like you ditch perfectionism and use food, fitness, and self-care to fuel your bigger God-given purpose. I believe that it's possible to achieve your biggest life-changing goals without the frustration, obsession, or negative self-talk that so many women subject themselves to every day. All you need are the right tools, the right mindset, and the faith to turn your dreams into reality. I'm here to guide you along the way. The truth is that you are so much more than a body, and I'm on a mission to help you change the way you think and act at a core beliefs level so you can transform your physical, mental, and spiritual health from the inside out. Are you ready to become fed and fearless in your pursuit of a healthy, meaningful life? Welcome to the Fed and Fearless podcast. Hey everybody, welcome back to the Fed and Fearless podcast. I'm Laura Schoenfeld, I'm your host, and I'm just so excited to have you here with me today. We have a great interview for you that I'm really excited about. I really enjoyed recording it, and I know that you're going to learn a lot about hormone health and fertility for those of you who have PCOS, and for those of you who know people that have PCOS, which I'm pretty sure is all of us. Anyway, I'm just really excited for you to get to know this special guest of mine today. She's getting pretty popular on social media and the internet, so I'm sure you've seen her face around. But she goes by the Women's Dietitian, and her name is Cory Levin. Now, Cory is a registered dietitian, nutritionist, and women's health expert. Cory's the founder and principal of the Women's Dietitian and Instagram account at the Women's Dietitian, a private practice and digital platform for women seeking nutrition support for hormone balance, fertility, digestion, and weight management. She specializes in conditions such as PCOS, endometriosis, Hashimoto's, and nutrition therapy for infertility and assisted reproductive technology. Cory dedicates her practice to a science-backed eating and lifestyle method she has created called cycle hacking. It's through this program that she customizes nutrition prescriptions for clients phase by phase of their cycle to optimize hormone balance and encourage healthy hormone levels. So Cory is all over the women's health world, and she's definitely a rising star as far as that area of the internet is concerned. And we have a great conversation today, primarily about PCOS, because that's one of her passion topics. It's something that she herself has dealt with. And we talk a lot about how to manage PCOS as well as how to improve fertility with PCOS. So not only the things to look out for, the kind of things to look into as far as treatment and improvement of health is concerned. We even talk about how to get your partner on board with the fertility process and make sure that he is also contributing his healthiest self to the pregnancy process. So I think you're going to love this episode. I really enjoyed interviewing Cory, and I think she's got a lot to share about hormonal health with the world. So without further ado, here is Cory Levin. All right. Well, I am so excited to have with me on the show today my friend and a fellow women's health expert, Cory Levin. Cory is someone who I got to know through some business mentoring, and I've just loved watching what she's been doing with her platform, which is the Women's Dietitian, if you follow her on social media, and just being able to see the awesome tips and strategies that she shares with her audience about things like fertility and hormone health and all that from a perspective of just helping take the fear and stress out of those kind of conversations, which I feel like can be so stressful for women that are dealing with them. So Cory, I'm so excited to have you on the show to chat all about fertility today.
Yeah, thank you, Laura. Me too. Very excited to be here today.
And as we're recording this, I know that you are, I think, are you like 7 months pregnant? I can't remember what your timeline is.
Oh my gosh, I know. Yeah, I am 8.5 months. Woo.
Oh, wow.
Yes.
Way closer than I was thinking.
I know. Yeah, it's so crazy. Time flies.
I know. For whatever reason, I was thinking your maternity leave was going to be like the month before birth, but it's actually probably just going to be like post-birth. So, but that's one of the benefits of being a business owner is that you get to actually have a healthy and happy postpartum maternity leave, which so many women are not able to have. So it's super exciting that you get to create that for yourself and have the space that you need to recover and enjoy being a new mom. So I'm super excited for you.
Definitely. Thank you.
So if any of our audience members don't know who you are, I want to make sure that they get to know you. So that way, after the interview, they can jump on your social media, jump on your blog, like get to know more about how you help women with fertility and hormone issues and all that good stuff. So whenever I have a dietitian on my show, I like to ask them about their journey because so many of us got into nutrition to like fix ourselves or to like, overcome our own challenges. And then now we are helping other women and other people do the same thing. So tell me about your journey to becoming a dietitian. What led you to where you are today with the work you're doing?
Yeah. And I love that question. It's nice to kind of start out a little bit more personal and get into it. So, how I became a dietitian. So unfortunately I have to start this very happy story with sort of a sad story. My father passed away about 3 years ago now, and he is 100% the reason why I do what I do. After I got my bachelor's, I decided to pursue a PhD in psychology. However, after one semester, I realized that it was not for me, and I left the program. And I was living in San Francisco at the time in a really small studio apartment. It was on the 7th floor of this like old crumbling complex with no working elevator. And I was funding my rent at the time with student loans. So I had to leave. I had no money. I had no job. I had no car. I didn't have anywhere to go. And my father offered me a room in his house to live while I got back on my feet. And I was a little nervous because I hadn't lived with him since I was 7, since my parents got divorced. And I didn't really know what to expect, but it turned out to be the best year of my life. He taught me everything I know about food and nutrition and cooking. Several years prior to that, he was diagnosed with prediabetes, and he quickly turned around all of his bad habits, and he lost 60 pounds, and he never looked back. And he was such an inspiration for me. So after college and my kind of failed grad school stint, I was probably the most unhealthy that I've been. I didn't feel good. I didn't have any energy. I think my hormones were probably all over the map. My PCOS, for which I did not have a diagnosis at that time, was pretty much completely ignored. So after living with my dad and learning how to cook and really nourish my body, I picked up a hobby, or I guess it was kind of an obsession with long distance cycling. I got really into that. I decided that I wanted to become a dietitian. I knew that I wanted to go back to school to pursue a higher degree, but I also wanted to keep working with food and nutrition. So that's what led me to becoming an RD. And it's been the most beautiful and rewarding experience. And I can definitely say without a doubt that I chose the right career for me. Yeah.
So I always love hearing people's backstories because there's so much diversity in why people got into what they did. And it's funny, you said that I never went to grad school for psychology, but I did my undergrad in psychology.
Oh, did you? Yeah.
I thought I was going to like do the PhD route. And
Sure.
I took a year off and lived in Australia. And that's where I got exposed to like health and nutrition, like more in the like real food, ancestral health kind of mindset. And, I was like, actually, this is really interesting. Maybe I don't want to do a PhD in psychological research. So, and now we're both here. So,
amazing.
You mentioned that you didn't have a PCOS diagnosis, but now you know that you do have PCOS. So can you tell us a little bit about your personal health journey, learning about that condition and really managing it from a holistic perspective?
Absolutely. Yeah. So before I was diagnosed with PCOS, I had never really heard about it. But now that I am kind of in this space, I realize, and I know how common it is. It's like 1 out of 10 women that they estimate have PCOS, and it's the leading cause of infertility in the United States. So when I was sort of getting into hormone health and trying to figure out, kind of starting my own journey with that, that's when I started learning more about PCOS, and I thought, this sounds like me. So I went to, there's a variety of tests that you can do with your doctor and get a diagnosis. But most of the time, and not always, but most of the time when you go to the doctors and you get a PCOS diagnosis and you're not trying to conceive, they will just offer you birth control. And I knew that I didn't like being on birth control for a variety of reasons. I knew that I didn't want to go that route. So I started to really do my own research and figure out exactly what I needed to do in order to, there's no cure for PCOS, but in order to kind of mitigate the symptoms and feel better. So within that, my journey included really nutrition-wise, focusing on blood sugar balance. So I would say I'm a recovering carbaholic. So learning how to pair carbs, complex carbs with fats and protein and fiber to kind of negate the blood sugar spike that would otherwise happen when I'm eating carbs was key for me. And, blood sugar balance is super, super important for PCOS because there is a big insulin resistance component and also androgen excess, which they're all linked together. So that was a big one for me. And for me personally, also stress reduction. It's the most, easier said than done one, but it was so key. And I think that a lot of women with PCOS kind of, they don't end up putting enough stock into this part of PCOS because it really can play a big role in what your hormones are doing and how your PCOS is kind of behaving or misbehaving.
I was just going to mention that blood sugar piece is so huge. And I think a lot of times women assume that based on what they've read on like WebMD and that kind of thing, that PCOS means
Dr. Google
that PCOS means you have to be low carb. And I imagine you're similar to me in the sense that you believe that as long as your blood sugar is balanced, there's no like specific macronutrient approach that's going to work for everybody for helping them resolve those PCOS symptoms. So what's your philosophy on macronutrients in general for PCOS? Because I work with so many women that are like, oh, well, I have PCOS, so I know I should cut carbs. And I personally don't think that that's the case for most women with PCOS, that they need to be like keto or something. So what's your philosophy?
Totally. Yeah. The keto and, being super, super restrictive might work for, a few months, but after that, you're probably going to fall off the wagon because things like keto are so difficult to maintain over the long run. And PCOS, like we chatted about, there's no cure. You have PCOS forever. So it's figuring out what works best for your lifestyle. And PCOS looks so different on every woman. My PCOS looks different than the woman next to me PCOS. So it's figuring out what works best for your body, what type of PCOS you might have, or what your unique, what we call carbohydrate tolerance might be. So figuring out, what works in terms of carb intake for you. And like for me, I can probably eat more carbohydrates than somebody with more insulin resistance or higher androgen levels. So it's figuring out what works best for you. So there's really no kind of cookie cutter template that we can say, do this one thing and your PCOS will be gone. So, and that's a tricky part about the diagnosis. And that's the most frustrating part too.
Mm-hmm. Yeah. And I think, with PCOS, especially being, even just the name itself is controversial, right? Yes. Like if people aren't familiar, PCOS stands for polycystic ovarian syndrome. I always like, when we're talking RD to RD, we're just like, oh, PCOS, obviously, I know what we're talking about. And so polycystic ovarian syndrome, one would think, oh, that means you have cysts, multiple cysts on your ovaries. And that's a big myth about PCOS, that one, that you have to have cysts on your ovaries because you don't. And two, that having cysts means you have PCOS, which it doesn't. Right. Exactly. So no wonder there's so much confusion around this condition, because even the people, like the naming society of like endocrinologists and that kind of thing, they don't actually know what to call it because it's not consistent. Everybody's different. And even the things that, the markers that people use to diagnose aren't even necessarily showing the full picture.
That's so true.
So blood sugar control, stress management have been things that have really helped you significantly with managing your PCOS, which, like you said, it can't be cured in the sense that you can't just like go back to eating a diet that doesn't support your blood sugar and not develop the symptoms again. But I believe, and I assume you're the same way, that like you can get to a place where you basically don't have the clinical symptoms of PCOS for the most part. I mean, maybe you'll have a little bit here and there, but you know, when we say there's no cure, it doesn't mean that you can't actually get to a place where your hormones are completely normal.
Exactly.
So is there any other strategies or like big picture things that really helped you manage your symptoms and manage your fertility that were, I don't say non-negotiables, but things that you would want other women with PCOS to know about that they can go put energy and attention into?
So 2 other things I can think of, exercise modification. So trying to sweat away your PCOS is not the way to go. It's, kind of combining more restorative workouts with more higher intensity ones. And, I think there's a misconception out there, that women with PCOS can go super ham at the gym 6 days a week and then, their symptoms, poof, they're gone. But you really have to focus on balancing that out, because when we're exercising super, super hard and too frequently, it can cause our cortisol to go higher. And that's exactly what we want to avoid. So that was key for me. And I think it can definitely be helpful for a lot of women out there who are wondering, kind of where exercise fits into this equation. There's definitely a balance. We want to have you exercising, but we don't want to have you exercising too much. And then cycle tracking, as far as kind of bringing in the fertility component, I have found to be key in understanding what's going on in your cycle, confirming ovulation. Did you ovulate? Did you not? And then if you aren't, what's going on? How do I kind of look at that and use that information in order to guide me moving forward? I think a lot of women now use, apps on our phone, and which are helpful, but they can't confirm ovulation. So I'm a huge proponent of using a kind of cycle tracking device to take your temperature and figure out exactly if you're ovulating, and if you are, when that's happening. And that gives you a kind of a full picture of what's going on hormonally. And that also tells you, as far as fertility goes, when you're in your fertile window and when the best time to conceive is, which when you have irregular ovulation and irregular cycles is so important to know.
Yeah. And I would love to talk about the fertility piece, because I know that you have a program called Get Pregnant with PCOS. And so, and you've gotten pregnant yourself with PCOS. So this is something that I know you're an expert in. I know that with PCOS, there's, like we said, so many different elements that can affect somebody's fertility, somebody's symptoms, that kind of thing. But in general, what would you say are some of the most important elements to consider if a woman with PCOS is struggling to get pregnant?
Yeah. So taking a look at ovulation. So one of the big hallmarks of PCOS is irregular ovulation. So what that basically, to come out of my RD world also, if you are not ovulating, you cannot get pregnant naturally without some kind of intervention. So looking and seeing and confirming and being able to know if you're ovulating regularly or not is so important, because if you're not, and that's part of your PCOS, that's something that we have to hone in on and fix and work on. So, some women with PCOS ovulate a few times a year, some don't at all. So it's easier to achieve pregnancy when someone's ovulating even infrequently versus not at all. So taking a look at someone's ovulatory patterns is definitely something that I look into. And that way we can that will help guide our work and see what we need to be working on.
And real quick, I want to add, just because, like I said, RD to RD, you and I both know, the things that maybe a lot of other women don't know. One thing I always see is confusion around menstruation and ovulation, because I mean, we don't learn any of this stuff when we're growing up. Like, we learn such basic information about the female reproductive system, and it's like body literacy is so low in our country, especially for women, that there's no shame in not understanding this, because unless you're doing the work to research it yourself, it's not like this is common knowledge. But one of the things I've seen a lot of confusion around is this belief that as long as you're getting your period, it means you're ovulating. And especially with PCOS, but like even with, I say hypothalamic amenorrhea, there's a lot of women that I work with that are kind of recovering from hypothalamic amenorrhea, and they're getting their cycle, they're bleeding, but then they're still struggling with the fertility piece. So can you tell us a little bit about how to know if you're actually ovulating versus having an anovulatory, which means no ovulation, but still having a menstrual cycle?
Right. Yeah. So a good indication is if you have a regular cycle, if you're having a bleed that's whatever they have, 3 to 7 days, every maybe, 21 to 35 days. If that's happening regularly for you, that's a pretty good indication, but it doesn't always mean that you're ovulating monthly. So the best way to do that is taking a look at or diving into kind of cycle tracking and tracking your temperature and looking at your charts to look at patterns and seeing that way, whether or not you're ovulating before that bleed. Because there are women, with PCOS who might have 2 periods in a month. And to them, they think, oh my gosh, maybe I ovulated or I'm ovulated twice, or I don't know whatever assumption that they're making. But that's actually another hallmark of PCOS. Some women don't get periods, and some get 2 months, some bleed all month long. So it's that any of those kind of, red flags or something that might be able to signal that you're not ovulating and you might just be having anovulatory bleeding. Mm-hmm. So I would definitely pick up a cycle tracking device, some kind of basal body thermometer, something that measures your core temperature, track it consistently. And when you see a temperature spike and your temperature spikes and it stays higher, then that's an indication that you ovulated. Mm-hmm. And I won't go into the specifics because there's a lot to learn as far as cycle tracking goes, but that's what I would recommend in order to see whether or not ovulation is actually happening, or whether you're, like you said, you're just having an anovulatory bleed, which are unfortunately more common in PCOS.
It is normal to have an anovulatory bleed here and there for even like a person without PCOS. Right. So we're not saying that you need to ovulate every single month or there's something wrong with you, but I think there can be this misconception that, I'm getting my period. Why would I not get pregnant? It's because, hey, you may not even be ovulating. And I know another big element of, like, if we want to go to the next step with cycle tracking is the cervical fluid monitoring. I don't know if you know anything about this, so feel free to say next question if you don't, but with the cervical fluids, a lot of my clients are, again, the amenorrhea side of the equation. So they're not really producing any cervical fluid. Right. With women who are dealing with PCOS, I know a lot of times they're going to have high levels of hormones. Do you ever talk to them about cervical fluid tracking? And is that something that is impacted by PCOS? And are there any things to look out for there?
Yeah, so we definitely do cover that. And there are, I would say it's similar to maybe anyone who's not ovulating as far as pattern. There's no specific pattern for somebody with PCOS, but there are, when we're talking about cervical fluid throughout each phase of your cycle, there are kind of the standard what you would look for, and that's not happening, and things are kind of out of order, or you don't see any cervical fluid, or you see all, the really sticky kind, which means that you're not fertile. So the pattern, there's really no pattern, and it really varies. I always, and personally in my practice, I always recommend tracking cervical mucus or fluid as a supplementary with tracking your temperature, because we're sometimes, just like if we're taking ovulator predictor kits, we can get kind of false positives or false negatives. So it's not as, the data is not as accurate, I would say, as cycle tracking, and, using both together is great. But I usually don't recommend just using cervical mucus because it can give us sort of mixed signals. And if you don't know what to look for, then, or you just don't produce a ton, it might be higher up in your cervix and you're not seeing it every day and you're not checking for it correctly. There's all kinds of, kind of user errors that can occur. So I love that method, but I do recommend it in conjunction with cycle tracking temperature wise.
Yeah, definitely. Yeah. And like you said, there's tons of room for error when you're trying to figure things out. And again, another area of our body is that we really don't talk about with most people. So we're all about having helpful conversations on this podcast where women can actually get to know their bodies and understand them and not feel ashamed to talk about things like, what is this in my underwear kind of questions. So, anyway, I just wanted to ask about the PCOS question, because I know a lot of women are tracking that information as part of their like overall cycle tracking process. And, like you said, there can be some confusing, like, oh, I've had the same one for all month, or it never dried up, or like I never got that egg white. And it's like, what does that mean? Is it even meaningful? And it sounds like it is meaningful in conjunction with watching that temperature change.
Right.
Or lack thereof, I should say.
Yes, exactly.
So are there any other elements that a woman should be looking at if she is struggling with infertility and she knows she's been diagnosed with PCOS?
Yeah. So we chatted just a little bit about nutrition and blood sugar balance. We chatted about exercise, making sure that your supplement routine is kind of, for lack of a better word, accurate. I see a lot of women taking an excess amount of supplements that really aren't doing much for them individually. You know, for instance, a woman with PCOS who doesn't have high levels of androgens might not benefit from something like a 5-alpha blocker, or like a saw palmetto or something like that. So really figuring out or working with somebody who understands exactly what you need supplement wise, because supplements can be great. You know, we don't all eat perfect diets all the time. So and that's totally okay. So taking supplements to kind of help fill in the gaps can be helpful when you have PCOS. So working with somebody that knows their stuff and, you know, won't just let you take supplements willy-nilly can definitely be helpful. Sleep, definitely something that, you know, the importance cannot be overstated. So making sure you're prioritizing good, healthy sleep and stress reduction, making sure you have a consistent self-care routine. You know, that kind of, we chatted about that earlier as far as stress and cortisol. You know, caffeine and cortisol, not a good match. So taking a look at how much caffeine you're drinking. Obviously, you know, some in moderation is fine, but a lot of the research kind of, as far as PCOS and hormone balance goes, sort of points to that being not the best thing to drink all the time. So taking a look at that, and gut health as well. So looking into the health of somebody's gut, making sure there isn't a lot of what we call dysbiosis, when we have an imbalance of that healthy bacteria to kind of more opportunistic bacteria, because that can have, you know, an effect on inflammation and estrogen metabolism. So those are all things that that we look at when we're talking about PCOS and fertility.
And you mentioned gut health, and you also mentioned hormone balance in general, and making sure people are taking the right supplements for their needs. Right. What are some of the ways that you as a clinician help someone figure out if they need to address gut issues, hormone issues, that kind of thing?
Yeah. So there are a couple of tests that I run. One is the Dutch hormone test. And that one shows us a lot. Basically, it tests your sex hormone metabolites. So it's looking for things like estrogen and progesterone and androgens. And that's a great way to kind of get a better understanding as far as what your hormone levels are, what you might be needing to work on. And then as far as gut health goes, I use what's called the GI map gut health tests. And that kind of takes a deep dive into your microbiome and shows us if there's, you know, what kind of the general landscape of your gut looks like, and if there's anything that we should be addressing there. So that is something that I use with most every hormone balance or PCOS patient that I have, because the more data we have, the better. And it allows us to allows me as the provider to make more individualized, you know, kind of supplement and just kind of lifestyle and diet protocols for patients. So I recommend both of those tests. I love using them.
Do you find that a lot of the women you work with are dealing with gut dysbiosis?
Yes. Quite a few. Yep.
Yeah.
Yep. Yeah.
Do you find that it's usually showing up as symptomatic, or are there a lot of women out there that don't have gut symptoms and they still have some issues?
It really depends. It kind of, both. So I have some patients who don't have any real digestion complaints, and then we run a GI map, and oh my gosh, it is off the charts. Crazy. We've got a lot of stuff to work on, which is surprising for both of us, but it's very helpful in that sense. And then, you know, the other way around too, sometimes people have a lot of symptoms and we can see their GI map test, and okay, that makes sense that you're feeling that way. So it just both, I guess. It totally depends.
Yeah. Well, and I find when I do the GI map test that sometimes even the people that have a lot of symptoms, they don't necessarily have things like pathogens show up, and they were thinking, oh, I must have like SIBO, or I must have a yeast infection or something. And a lot of times it turns out that they either have like low beneficial flora, or they have, some kind of like immune dysfunction or inflammatory response happening in their gut, and it has nothing to do with like a pathogen. And I feel like that's one of the benefits of doing something like a GI map test, because you can have really bad symptoms and think that, oh, I have SIBO, so I need to like take oregano oil and I need to like go on a FODMAP diet and that kind of thing. And all the while you're actually making things worse, because your problem is that you don't have enough bacteria, and we should really be focusing on building that flora. So, my philosophy on testing is that if it doesn't affect what we're going to do, then it's rare that I'll suggest doing a test. But I do find that we can't know for sure that there isn't any issue in the gut. And especially with hormone balance, high estrogen, that kind of thing, a lot of times there are women who they don't get the results that they want to get until they actually look at their gut health. Like I remember a couple of years ago, I have a client who she got a SIBO test that her doctor said was negative. And this was, I don't even know if GI maps existed at this point. This was like 5 years ago or something at this point. And I looked at her SIBO test, and her methane levels were like 50 plus. Oh my God. Methane is supposed to be, I think, under 10 or something. And I was like, and I sent it to one of my physician contacts at the Kresser the Kresser Institute clinic. And I was like, can you confirm that this is definitely positive? And she was like, oh yeah, that's like really positive. So, and this was a girl with PCOS that, she was on thyroid medication. She was like told to take birth control. And like, luckily she knew that like being told to take birth control wasn't the answer. Like she just, and that's why she ended up working with me. But it wasn't until we dealt with her gut dysbiosis that she actually started getting her period regularly and started seeing like normal hormone function. So I always think about that as an example of like, if a doctor tells you, oh, don't worry about it, your gut's fine, especially if you have gut symptoms. Like she was having a lot of constipation and bloating and that kind of thing. And I was just like, and she was doing everything she could lifestyle wise, right? Like eating as healthy as she could, exercising appropriately. And sometimes that stuff's not enough if you have some stuff going on digestively. So I fully agree with using functional testing to help get to like the reason why, because even with the genetic component, having a gut infection on top of a genetic tendency towards PCOS, like you're not going to do too well if you don't get rid of that gut dysbiosis. So true. So true. Cool. And, is there anything else that you feel like you would add as far as pieces, like big picture pieces of the puzzle that women need to be aware of on their journey to getting pregnant with PCOS?
I think we covered the core pillars, I would say, make up, how I would approach PCOS in somebody who's looking to conceive. So sorry, there's a siren. So diet, blood sugar balance, exercise, proper supplements, gut health in check, sleep, caffeine, stress reduction. So those are kind of where I would start with somebody who is looking to conceive and has PCOS.
Are there any supplements that you would say are pretty universal, or are you always totally customizing? I mean, not that you wouldn't customize anything, but are there any supplements that you're like, yeah, I think all women with PCOS would benefit from talking to their doctor or their functional provider about taking this?
Yeah. So one of them that I love to recommend is Ovacetol, and that one, or Ovacetol, however you want to say it. I have no idea how to pronounce that one. That's a tricky one. That one helps to basically promote menstrual regularity. It's also great for egg health. And so that's one that I always recommend for PCOS and fertility patients. And omega-3 fatty acids are ones that I always recommend. So those are so great as far as, being really potent anti-inflammatories. But within that, you have to make sure you're choosing the right one. I think, there's so many types of omega-3 brands out there that just don't have what we really want to get out of them in them. So looking at the DHA and the EPA levels and making sure I always recommend over 500 at least for each one. And not all supplements will have that. So, definitely taking a look at what kind of brand, you're using, it makes a big difference with the omega-3 fatty acids. Vitamin D, a lot of women with PCOS are deficient in vitamin D. So that's something that I usually just recommend right off the bat, a lower dose. And then, once a patient gets tested, we can kind of go from there if we want to up it or not. But that's a big one also. And that's a really important one for fertility. So those three are the ones that I start with kind of right off the bat.
Yeah. I feel like I always pronounce it ovasitol, but again, just phonetic pronunciation here.
Yeah.
Let me figure that out. I'm like, they got to have something on their website where they explain how to pronounce it officially.
If they do, I haven't seen it.
I haven't seen it either. But I know that one, it's pretty generally safe for most people. I'd say the only people I would maybe be cautious around would be anyone who has like reactive hypoglycemia, since it is something that can potentially lower blood sugar, which for most people with PCOS, it's actually beneficial to help make them more insulin sensitive. I don't think I've ever had anyone have an issue with
I am very prone to that, to hypoglycemia, and I have never had an issue with it. But I also never reacted to metformin negatively when I was on it either. So, but everyone's different. Yeah, totally. Yep.
Yeah. I've had clients react to metformin, and I've had clients react to berberine even, which is kind of like I don't want to say functional replacement, but kind of is. It's like one of the herbal formulas that's almost like very similar to metformin in the way that it acts in the body. So, and that's where that working with a clinician is really important, because something that berberine's a great example of something that you'll go online and see, just Google supplements for PCOS. Like berberine's a really common one that comes up, but that doesn't mean that you're going to tolerate it well. Yeah. And berberine also being an antimicrobial, if you have gut issues, yes, it could be helpful, but also it could trigger some immediate symptoms because of the gut issues. So
true.
Excuse me. I'm always like, I want women to feel empowered to make decisions for their health. But when it comes to supplementation, I definitely feel like consulting with someone who's trained is really important, because supplements can be dangerous if you are just throwing stuff at the wall and seeing what sticks. So some of them are safer than others, but I think having someone to guide you on that, and also just making sure you're not wasting money and time on taking stuff that's not helpful.
Supplements are not cheap. So absolutely. Yep.
Yeah.
Totally.
And I'm sure you've had the experience where a client comes to you and they list out their supplements and they're taking like 30 different things. You're like, whoa,
yes.
why? Like, why are there so many?
Yeah, totally. Yeah. They've got their little pill their separator, their pill organizer, which I always recommend. I have one myself, but I mean, when you're taking like 35 supplements a day, I really want to edit that list and make sure that you're taking only what matters and what's going to be helpful for you.
It's like a part-time job managing that. So
totally unpaid.
Yes. And something we were chatting about a little bit before we got on the call is this concept of fertility treatment being so heavily focused on the woman. Both the treatment as far as like medical treatment for infertility, and then also like, I just feel like emotionally, a lot of times the woman is the one that's taking on a lot of that burden. And this is not universal. I know there's a lot of men out there that also take on the emotional burden, but from my experience working with women struggling with fertility, a lot of the times the focus is on fixing their body so that they can get pregnant. I would love for you to share with our audience more about how men's health comes into play, because we know statistically 50% of fertility challenges are actually related to the man's health. Which I think like when you say that, it kind of sounds like, oh, well, duh, it's like 50%. But the way that we act in terms of like people struggling with infertility, it's always like, well, what is the woman doing? And so I don't think, we were kind of joking before we hit record that for all these like women's health Instagram accounts talking about women's fertility and like cervical mucus and all this stuff, like we would love to know if there's a men's fertility Instagram account out there. So
I would follow.
If anybody knows of one, I was joking that only if they're also sharing fantasy football stats will any men follow that, but that's just being a little silly. But like I said, we know that men are definitely part of the puzzle. And if a woman's struggling with infertility, because I feel like we're going to have mostly women listening, so I want to help them empower their partners to get supported. So what would be some of the most important things that men need to be aware of to ensure that they're maximizing their, like, the couple's chances of getting pregnant?
Yeah. Yes. And I always say it takes two to tango. So talking about this I'm so glad that we're chatting about this. So when it comes to the kind of the male responsibility of fertility, it's all about sperm health. So within that, we're looking at kind of three things mainly. We're looking at volume, or kind of concentration. So how much sperm is actually being produced. Morphology, or kind of the shape. A lot of sperm can be kind of two heads or two tails. So making sure that it's kind of the correct shape. And then motility. So making sure that the sperm are actually swimming. And on top of that, making sure they're not swimming in the wrong direction. So sometimes they swim backwards, which doesn't really do much when they're headed for the egg. So sperm take roughly 64 days to kind of develop and mature. So that's a great, kind of time frame as far as if you're looking to conceive, trying to get your partner to sort of maximize his sperm health in that window is kind of best practice. Obviously, if you're already trying, then it is what it is. But that kind of 64-day window, 2 months about, is sort of a good time frame to think about. So making sure he's eating a diet that's high in nutrients that sort of nourish sperm health. So there's a few that I'll just kind of list off. CoQ10 is one of them. Zinc, vitamin C, vitamin B12, and those omega-3 fatty acids, again, are back. And then lifestyle-wise, making sure he's not going overboard on caffeine or alcohol intake. If he's a smoker, to quit smoking. And make sure that he's exercising daily. And sperm are only produced at a specific temperature inside the testicles. So not spending too much time in hot tubs or saunas, not wearing super tight, restrictive underwear or boxer briefs or pants. And also one that we don't think about, making sure he's not always putting his laptop over his lap, sort of, heating up the family jewels that way. And then also sleep, making sure that he's, again, just like women, trying to conceive, making sure that he's prioritizing good, high quality sleep. I always recommend the average, or the recommendation is about 8 hours per night. So those are kind of the key things that I like to talk about when it comes to sperm health, and making sure that your partner is doing all that they can in order to sort of maximize reproduction function as well.
Mm-hmm. Yeah. And you mentioned CoQ10. I'm familiar with, I think, some of the dietary sources of that. I know obviously there's lots of supplement options for CoQ10. Is that something you would typically suggest just supplementing with, or is there specific foods that you would, increase in somebody's diet?
Yeah. So there are food sources of CoQ10, cabbage, oysters, liver, avocado, oranges, broccoli. These are good sources, but they're not super high in CoQ10. So I do recommend supplementing with a CoQ10 just to kind of make sure that you're kind of getting adequate levels, because like I said, the food sources aren't super, super high in them. So that is a supplement that I would recommend.
Mm-hmm. Mm-hmm. Yeah, I was going to say, because everything else, I was like, I know all the food sources of the I think CoQ10. The one that comes to mind is beef heart, which is
who eats that all the time.
not me. Heart is highly concentrated with CoQ10 because it's actually something that affects contractions. But like you said, I mean, unless somebody is super dedicated to eating beef heart every day, which I suppose you could if you wanted to, this is where good quality, appropriate supplementation can really be helpful. So, and it's funny because you were like, laptop, not on the lap. It's like, we should just rename those things to like tabletops or something like that.
I love it. Totally. Yes.
Which I'm sure is a lot more common than people like to admit. I know I use mine on the couch a fair bit. So little tweaks like that, I think, are always smart to incorporate, even if, I mean, it may not be the answer, right? Like if somebody's having sperm issues, it's not like, oh, just stop using your laptop on your lap and everything will be fine. But we're looking at what are elements that you have control over, that you can make some changes around that aren't completely life altering, So
right. And if in the small chance that is something that is affecting sperm production, I mean, that is such a better route to go than getting into, not, I shouldn't say better, but that is an easier route to go rather than heading into, when you get into the assisted fertility treatments and the cost of that and the emotional toll of that. So definitely first taking a look at things like that are controllable, that are easy to carry out, before you go that route, because it is, once you start going down there, and I've, started to go down that path myself, we'll talk about this later too, but it's emotionally, physically, mentally, it can be really draining and really hard. So, so taking a look at whatever like you said, you can control first is a great way to approach that.
Yeah. And like I don't think I need to necessarily emphasize this because I think you did, but reminding our audience that we're not saying fertility treatments are bad or that you shouldn't do them. This is something I feel like I have to always get really clear about with I have an online program called Get Your Period Back. And I work with a lot of women who are not menstruating at all. And they're working towards recovering their menstrual cycle, recovering ovulation so they can get pregnant. Sometimes they still need some fertility support with medication. And I am 100% like, if that's necessary and that's something that is, because not everybody wants to go that route, and that's fine too. There's no morality associated with it. But knowing that that's not the first place to start is really important because first of all, I think so many people don't need to do it, right? I mean, just having the experience with the amenorrhea crowd, so many of them, once they make the changes that they need to make with their diet, their exercise, their lifestyle, their supplementation, just the same stuff that you were talking about.
Yes.
A lot of times they do get pregnant naturally without having to do any support. But my perspective is, even if the fertility treatment is necessary, let's maximize somebody's chances of the rounds of treatment that they're doing to actually take. Because I forget, I did the stats on this for a free training that I have on amenorrhea, and I forget what exactly the success rate is, but I think it's like less than 50%. Maybe it's around 30% per round of fertility treatment as far as
IVF?
I think it's IVF. I should be careful. I don't want to like misspeak as far as misquoting statistics, but I remember it's like well under 50% success rate for each round of IVF that a person goes through. And if you think about like a round of IVF can be like $10,000 or something to do. My perspective is let's do whatever we can to prepare your body to maximize the likelihood that treatment actually works. So you're not doing 3, 4, or 5 of them to try to get pregnant. And again, just so like asterisks all over the place, those treatments not working, I don't want people to think it's my fault 100%. Like blaming yourself, and we'll get into this in a second, like blaming yourself or like having shame around it is not the goal, but the goal is to be educated and to know like what pieces of this puzzle do I have responsibility for, and what changes can I make that I have control over that can help the process. And then, the rest of this is out of my hands. Like I can't force the IVF treatment to work or that kind of thing. So, and like I said, I know this is going to be an important part of our conversation. It's that balance between not blaming women for infertility or for the challenges that they're experiencing or for the treatments not working, but also giving them a strategy or an action plan so that they can do everything possible to maximize their chances, and they aren't missing a giant piece of the puzzle that if that was to be fixed, everything would be working. So that's our goal. And I just want to make that clear because I feel like you and I were talking before we got on the call that like infertility is such a emotion heavy subject, and we want to be respectful of it, and we want to be mindful of like where women have put this effort in and they're not seeing the results, and we're not saying, oh, it's easiest 1, 2, 3, like just do these steps and you'll get pregnant. We just want to make sure that they're not missing an important step that could be part of the process for them. So
totally. Yeah. I think infertility can feel really out of our control sometimes. So taking a step back and looking at factors that we can control is a great place to start.
And I feel like, I mean, we could apply that to any health condition, but when there's so much not in your control, like we said, 50% of it is your partner, and you can't control your partner's health, right?
Yeah,
like even if you send him to this podcast and he hears what we're talking about with sperm health, and he's like, you know what, I'm just not gonna stop using my sauna or my hot tub or whatever. And, and I don't know about sauna. Actually, I should just say the hot tub. I don't know if there's research about sauna, but, you can't control what your partner is going to do. So, and you can't control the decisions about the medical team and what kind of strategies they're using. So we know you're not in full control, and the goal is not to be in full control. The goal is to say, what can I do to influence this, and what power do I have in this situation? All of that said, that I think leads us to the question that I did want to talk to you about is, part of the theme of this podcast is really working to eliminate fear around health and like decision-making around health and health practices, because I do think the downside of the world we live in today with podcasts, blogs, internet, all, like you said, Dr. Google, is that there's information overload to the point where women are like, what do? I feel lost. I'm confused. I'm not sure what to do. Like, I tried all these things. They're not working. I feel like I'm putting all this effort in. I'm not seeing results. And they really start to get either down on themselves, or they have a ton of anxiety and they're afraid they're going to do something wrong. So what would you tell a woman who is stressed or having fear around the idea of facing the challenge of infertility?
This is such a good question. And it's so individual for so many of us. I can say firsthand that I've been there. I've been, in the waiting room of a clinic of our reproductive endocrinologist. And, because of my PCOS, been told, here's the rough outline, here's our plan. Here are all the, giant hoops that you have to potentially jump through in order to achieve the small chance that this might actually happen for you and your partner. And that's not an easy pill to swallow. And I would tell, and I do tell all the time, actually, a woman trying to conceive who's potentially facing infertility, two things: don't give up and find your tribe. So the first, being don't throw in the towel just yet. We have infinitely more knowledge than, on the subject than we did 30, even 20 years ago. And there are people like myself working in this space to make your dream a reality, and you can't give up. There are so many routes to explore in terms of fertility. We've chatted through a bunch of them, both natural and conventional, and both are helpful. Neither one is better than the other. And it's definitely a personal choice. You have to keep going and keep trying everything until you get what you're after, because it's so worth it in the end. And for those moments, and let's be real, days, weeks, even months that you don't want to keep going, find your people. Find a community, whether it's online, whether it's in person. Find a support system, or just one person that will listen to you and empathize with you and make this potentially long journey significantly less lonely. Because as women, we have to be there for each other, because infertility is not easy. So those are the two pieces of advice that I would give.
Awesome. And I would even add to that tribe piece. Yeah. What I find is that a lot of women, their quote unquote tribe in the process is their husband. And I'm not saying that you don't talk to your husband about it. Like, that is not the point. The point is that I really feel like women need to be able to talk to other women about what they're going through. And for the health of the marriage through that process, it's really important to not have your husband be the only support system that you have. So true. And again, I think it's really important to communicate with your spouse. And I'm not saying just don't talk to him about it, just leave him alone. Like, clearly this is like you're both in it together. It's a team effort. Like, everybody's got to be on the same page. And, I think part of the stress can come from when the woman is the one doing the work and the man is not. And I don't think I think 9 times out of 10, it's ignorance. Like, men are not being told what to do. So they're just like, okay, hon, like, I'll help you be the one that's doing all the stuff. And so, making sure that everybody is working together, but also recognizing that, like, up until very recently in human history, women had their like community of women that they spent time with, that they interacted with, that they shared struggles with, that they were open and vulnerable with. And I feel like, unfortunately, not everybody is blessed to have that kind of support network in their lives. And so, just like you said, looking for whatever opportunity to get support around that area that exists, whether that's a Facebook group, whether that's an online program, whether that's a therapist, like whatever is available, I think needs to be part of it, because again, I know it can be really hard on a partnership or a marriage when you've been facing infertility and it's been years and it's been, a unfruitful period of time. And I don't think that we were created to just like hole up with our partners and just like face these problems without any other support. So, and I know you definitely agree with that, and you were just sharing with that. And I just wanted to kind of emphasize and drive that point home, because I get into this problem too sometimes. Like, it's so easy to go to your partner for everything.
Totally. Yeah.
And female relationships can be scary. Like, I don't know about anyone else, but I had a pretty unproductive friendship like journey up until recently. And not that I'm saying I don't have any friends from before, but like pretty much it took me 25 plus years to get to a place where I was comfortable opening up to my female friends and being in a community of women that I felt like I could actually be myself around. And so the good news is there's always, you're never too old. There's always an opportunity to make these connections. But I think it really, it takes some courage and it takes some intention, because it is a lot of times easier to just be like, oh, it's me and my husband against the world, and we're just going to fight this together. And it's like, I don't think that that's the healthiest way to approach infertility. And it really, and now I'm like word vomiting, so I apologize, but I was just going to say, I feel like it makes women feel really alone. And I don't know the exact stats. You might be able to correct me on this, but I've heard that 1 in 4 couples struggle with infertility. It might even be more than that at this point.
Yeah, I've heard different ones, so I can't say I can correct you right away, but that's one of the statistics that I've heard. Yeah.
So it's one of these things where it's probably a lot more common than we even realize.
Right. And we don't always talk about it. So,
So if you have the opportunity to connect with other women that are going through the same process, I think that can be really valuable.
Definitely. Yeah. And I think that's one of the great things that we get out of social media these days is it is very easy to find, a community online and connect with other women going through similar things. There's of course a lot of dark side to social media and technology, but that is one of the greatest. And I so appreciate it for that.
Yeah. It's weird. It's like, I definitely would not trade my in-person relationships for online, but I also think there's so much good that has come from the ability to connect with others online. I mean, even like this conversation wouldn't exist without the internet. And, there's probably a lot of stuff that we talk about on podcasts and blogs and stuff that women wouldn't know about if it weren't for social media and that kind of thing. And I know you're super active on Instagram, so I know there's probably a lot of women coming across your work that are like, oh my gosh, I had no idea. And then that has a ripple effect into their lives. So, and actually that kind of leads me to another question I wanted to ask you, because we've so far with this podcast, I'm hoping to interview a lot of RDs or nutrition or fitness experts that are kind of blazing their own trail or carving their own path with like online and just private business development. And because I'm happy to talk to somebody who is working in a traditional position or, working in a hospital, that kind of thing. But I think there's something about the women who are stepping out to kind of create a platform that makes them a little different and kind of, I don't know, I just get inspired by chatting with women who are taking risks and kind of overcoming fear to step out into what they see their purpose as. So I love having that as an inspiration, whether or not you're a business owner or a dietitian. I think just being able to be inspired by women pursuing their purpose is really part of the mission of this podcast. So all of that said, I would love to know from you, what is your big vision for the work that you're doing in this field, and what's the impact that you hope to have on the world?
Such a good question. I wanted to kind of circle back on the dietitian aspect of this too, because for those listeners who are not dietitians or maybe future dietitians, and it might differ per program, but my program that I was in when I went through to get my master's and, get licensed, they were all about clinical. And by clinical, I mean working in a hospital right off the bat. Basically, if you don't start with clinical, if you don't start working in a hospital as an RD, good luck. And that is just so not true. There are, we can have such an impact working in these sort of less conventional fields, like hormone balance and fertility, than we give ourselves credit for. And nutrition is so important to women's health, and it's undeniable. So, kind of where I want to take my work, and I think I've done more in the past year than I ever even dreamed for myself. So I hope that I can kind of continue to inspire women to be the best versions of themselves. And I hope to advocate for more research on things like PCOS, because there is not enough, and infertility as well. These are two things that I really hold near and dear to my heart. And with PCOS being the leading cause of infertility in the US, I know that other women are looking, towards us as healthcare providers to do more. So, and then within that, not just from the patient kind of, RD role or dietitian role, but also helping to inspire other future dietitians or current, in the sense that, like I said, when you graduate, you don't have to go straight to a hospital. You can pursue these sort of different means to figuring out how you're going to be most impactful and helpful in the field. And I hope that I can work with future dietitians and kind of, who want to learn more about hormone health, and fertility, and ultimately, open up more discussion around some of these topics that we don't typically talk about around the dinner table, like sperm health and menstruation and endometriosis and all of these things that, women potentially can come across while they're in their fertility journey or just sort of in their health journey personally, and kind of open a bit more dialogue around that. Yeah.
That's awesome. I remember, I know, Laura Brydon.
Yes.
She's like the queen of, of hormone health. I met up with her in LA a year and a half ago, and ended up spending like the whole weekend with her. She's an amazing
person. That is awesome.
Yeah. She's one of those people that like is even cooler in real life than she is online. So
love those.
Yeah. It's always nice when somebody's actually like better than they are online, as opposed to like, oh, I thought you were like somebody that I was going to like, and now I feel like my dreams have been crushed. So she's amazing. But I remember we were walking around Venice Beach one night, and like I was just explaining to her, part of my vision for my business is to, from a different angle, because I feel like a lot of the women's health stuff comes from an angle that tends to not resonate with the faith-based community, just because I think there's a lot of weird stuff in the faith-based community that is not appropriate and kind of prevents women from connecting the dots about their health or like having these kind of open conversations. But I was telling her, like, part of my vision is creating a space for women who maybe grew up in more like traditional or conservative homes, or just like have this like more conservative mindset around women's roles and women's health, for them to be able to experience a different perspective or have these kind of conversations that like, we're not talking about anything that is, oh, down with men or like smash the patriarchy, but we're helping women understand what their needs are, and showing women that like, hey, you're different than men. You're equal to men, but like you're different, and different. I love that. And it's really important to know, like, what does it mean when your body's having these symptoms? What does it mean when, you're reacting this way to foods, or like, stress causes these problems, and how to actually, advocate for yourself to help get them solved. Because I know you're aware of the complete lack of research into women's health conditions, and doctors being a little flippant about women's symptoms. Not all, but it's certainly not an uncommon story. So I think your vision definitely aligns with my vision for this podcast and for my work, where I want to help start these conversations so that women can talk to their friends, talk to their doctors, talk to their moms, like talk to their people, talk to their tribe
Right.
about the stuff that they're dealing with and not feel shame, not feel anxiety or fear, and get the help and support that they need to see the progress that they want to see. So I'm super happy that you could come on the show and talk about it. I know we've just scratched the surface of your knowledge and, what there is to learn about this topic. I do have one more question that I like to ask my guests that I did not prepare you for. I always like, I'm sure at some point if people start listening to the show, once it launches, they'll be like, I know what's coming, but you get to be one of the first ones that's surprised. But it's not that big of a deal. I just, I'm like, if you're a planner, I didn't let you plan for this, but,
I'm a planner.
But the question is, what do you believe makes a person more than a body?
I would say, first thing that comes to mind, perspective. Being able to incorporate all different kinds of viewpoints and cultures and ideas and beliefs and values and kind of roll it into perspective. And that's yours. It's unique. It's individual. It's nobody else's. Does that answer the question? Is that like the answer you're looking for? I
love it. You're like, did I get a good grade?
Did I get an A? More than a body. I love that phrase. And to me, it conjures up a lot in my mind, but that's something that I guess that's top of mind for me. Bringing your own perspective into who you are and what you're doing, which is so important. I think we've touched a lot on that today.
Awesome. Well, the good news is there is no right or wrong answer.
Oh gosh, all right.
It's so funny because I've interviewed like pretty much at this point, mostly actually all dietitians.
Oh, right, yeah.
And I feel like dietitians
we all want to get a good grade.
We're like type A to the bone and tell me if I'm correct about this answer. So that's why I apologize in advance for being like, I'm sorry to tell you that this was going to be on the quiz. So.
I can definitely see dietitians acting that way. Yes. Mm-hmm.
And it's a generalization for sure, but I have yet to meet a dietitian that is super type B. And people can prove me wrong. If anyone knows a type B, like super chill,
I want to know.
Not high achieving dietitian, let me know. Cause my experience has not led me to one, but all that means is that we are committed to seeking truth and seeking the right answers for our clients and
100%.
Doing our best to support them on their journey to better health, better happiness, all that good stuff. So
absolutely.
All that said, you did not fail the test. So you can breathe. Then the last question, which hopefully this will be an easier one, is where can my audience connect with you further and continue to learn with you on their journey to better hormonal health and fertility?
Oh my gosh. Okay. I did plan for this one. I feel a lot better. So my website is thewomensdietitian.com and my Instagram handle is the same. So at the Women's Dietitian, those are probably the best ways to find me. My website will tell you, kind of my backstory, what kind of services I provide. I do, work one-on-one with women virtually. I do have a program called Get Pregnant with PCOS. I'm running it right now, so it's not currently open, but I will open it again next year. So that is something that you can easily find on my website. And then my Instagram is something that I stay pretty active on too, and women can definitely, or men can give me a follow on there. So
awesome. And is there a wait list for the program that people can jump on?
That is a good question. For the next round, I don't have one yet, but I will have one up sometime next year, and I will make announcements. If you sign up for my email list or you follow me on Instagram, I'll make announcements on that.
Awesome. So if they're following you, they won't miss their opportunity to join.
Yes, I will talk a lot about it. And I am on maternity leave until January. So I do have a wait list on my website that you can join for one-on-one work.
Awesome. Well, that's so exciting. I'm so happy for you. And just not only to watch your business grow and see all the really awesome stuff you're producing to share with the world, but also just for this next stage of your journey personally, your motherhood transition. So no pressure to share all that on Instagram with us, but I'll be excited to see the next step of your journey on social media, since I know you're great at sharing personal experiences and you're better than me at it. I'm trying to learn how to be more open on Instagram. I'm just like, I don't want to jump on stories.
I know. It's definitely like a muscle that we have to flex. So
for sure.
Yeah.
Awesome. Well, thank you so much for your time, Cory. It was really great to chat with you, and hopefully we'll have you on the show again in the future. But we'll see everyone next time on the podcast.
All right.
Bye,
Thank
Cory.
you. Bye-bye.
Hey everyone, thanks so much for listening to the Fed and Fearless podcast. If you loved what you heard today, be sure to subscribe and leave a review on iTunes so I can keep sharing my best content with you every week. And use the hashtag Fed and Fearless when sharing the episodes that you love the most on social media like Instagram and Facebook so I can connect with you personally. And if you're enjoying the content I've been sharing on this podcast, you're going to absolutely love my free online training, The 5 Secrets of Fearlessly Healthy Women of Faith. This training covers the 5 most important shifts you must make in order to become truly healthy and free from fear around your health decisions. Listen, I know beyond a shadow of a doubt that you were created for so much more than fear and frustration around food and fitness. Let me show you how you can experience true freedom in your health and incredible purpose for your life. If you're ready to experience true peace and freedom in your health, here's what I want you to do. To watch this free training, go to fedandfearless.com/free. That's fedandfearless.com/FREE free. You'll get instant access to this 1-hour training, and you'll walk away with a brand new method for approaching health from a faith-based perspective, so you can live the purpose-driven life you were created for. Go get your free download now at fedandfearless.com/free. All right, I'll see you on the next episode. Until then, get out there and be fearless in your pursuit of a healthy, purpose-driven life.